This is Mrs. Weaver, and I'm going to explain your vital signs skill evaluation. First, you want to make sure you have the appropriate armamentarium. That is going to include your stethoscope, your blood pressure cuff, and you want to make sure you have access to a clock or watch with the seconds display. First, we're going to go over pulse and respiration assessment. I want to make sure I determine that the patient has not had any alcohol, caffeine, or performed any vigorous exercise within the past 30 minutes before taking their assessments. After I seat the patient, I want to allow them to relax for a few minutes if they have. Then I can begin my assessment. I also want to make sure I explain my procedure to my patient and see if they have any questions. Make sure you are talking at an appropriate level and in layman's terms so they understand. Then I will seat my patient, and this is how my patient will look. I want to make sure my patient is in the upright position with back supported on the operator's stool. I'm going to select the appropriate armrest for the patient's arm on the countertop and make sure her palm is facing up, ensuring the patient has both feet flat on the floor. Once we have our patient in the appropriate position, we're going to go ahead and do the pulse and respiration assessment. So remember, we're taking pulse for 1 minute and respiration for the next minute. Our patient thinks we're doing pulse for 2 whole minutes. If they knew we were taking a respiration, they would probably alter their breathing. So we're going to go ahead and place our 3 finger pads here on the radial artery. The radial artery is basically the thumb line here. We're going to make sure our index finger is going to be closest to our patient's heart, and then we're going to go ahead and press down till we can feel that pulse. We're going to make a mental note of that pulse for 1 minute and then move right into respirations, keeping our fingers in place. When we are performing our respiration assessment, we are watching our patient's chest and shoulders rise. We're going to make a mental note of this for 1 minute, and then eventually we're going to go ahead and document our pulse and respiration assessment, communicate that with our instructor, and then eventually communicate that with our patient as well. Next, we're going to go ahead and do our blood pressure assessment. We want to first make sure we explain the procedure to our patient using layman's terms and be able to answer any questions they may have. Then we're going to take our blood pressure cuff. We're going to make sure that there's no air in the cuff and that the dial is at 0. And then if my patient does have a long sleeve shirt on, we want to make sure they roll up their sleeve before placing the cuff on their arm. Now I'm ready to go ahead and position the blood pressure cuff. I'm going to position the cuff with the lower edge 1 inch above the antecubital fossa. This is going to be 1 to 2 inches above the elbow, with the midline of the bladder centered over the brachial artery. I have wrapped the cuff smoothly and snugly around the arm and fastened it securely, but I do have enough room to slide 2 fingers under the cuff. Then I'm going to assure the patient's arm is supported with the antecubital fossa facing level with the patient's midline or their heart facing up, and the patient's arm should be somewhat bent and relaxed. I also want to make sure the dial is visible. These dials can be unattached and placed on the counter if needed. Now I'm going to go ahead and take an estimated systolic pressure. So I'm going to palpate the radial pulse with the finger pads of 1 hand. I'm going to close the needle of the valve of the bulb, and then I'm going to start inflating the cuff. I'm going to inflate it rapidly to 70 millimeters per mercury, and then increase it by 10 millimeters of increments until the pulse disappears. This is going to be my estimated systolic pressure. Once I get that, I can go ahead, open the valve, deflate the cuff rapidly, and make a mental note of that pressure. I'm going to then go ahead and wait 30 to 60 seconds before actually taking my blood pressure. I have my estimated systolic pressure noted in my head. I'm ready to go ahead and start taking my blood pressure then. So I'm gonna place the stethoscope earpieces in my ears. I just wanna make sure that these are facing forward and I can place them in my ear canals. Now I'm going to gently place the amplifying device over the brachial pulse point, just above the antecubital fossa towards the inner aspect of the arm. I'm going to hold the device in place, but I want to make sure that the entire circumference, so this entire piece here, is intact with the skin here. I want to make sure that there's no cords or the cuff is not touching the device. I'm going to close the valve of the bulb here, and then I'm going to start briskly squeezing the bulb rapidly to inflate the bladder to a pressure 30 millimeters per mercury above my systolic estimated rate here. I'm going to make sure I'm starting to listen for sounds, and I'm going to open the valve so that the pressure drops no faster than about 2 millimeters per mercury per second. So just about there. Once my sound dissipates, I can go ahead and make a mental note of that as well. So as you're taking your patient's blood pressure, you want to make sure you pay careful attention to the sounds heard in the stethoscope. You want to note the point where you first hear a sound, and then also note a point where the sound dissipates. So those will be your two pressures that you will be accurately recording. Okay, so when you are releasing the pressure, like I said, you're going to be releasing it about 2 millimeters per mercury. And then when the sound disappears, you want to go ahead and continually release for another 10 millimeters per mercury. Once that's done, you can go ahead and release it fully and go ahead and deflate the cuff. I'm going to accurately record my findings in my treatment record. It's going to read as a fraction. It's going to be your systolic rate over your diastolic rate. And then you're going to go ahead and communicate that with your instructor and then eventually your patient.